Botox has become a cultural icon in the United States. Even my 11-year-old daughter makes comments and jokes about Botox. But what does Botox do? Botox is a muscle-relaxing drug which we in facial aesthetics can use for two major applications. One is to relax and smooth wrinkles, and the other is to shape the face. When used correctly, Botox can relax facial muscle expression in a natural, comfortable way without making you look like a mannequin, without making you look frozen, without making you look like you have no facial expressions. For the last 20 years, it was the only drug in its category in the market. More recently, a new drug called Dysport has become available as well. Very similar to Botox, both drugs have to be administered via injection. They're tiny needles, and there's almost never downtime or recovery time or bruising after these injections. But be aware that it does take about 3 days or so before you start to see the effects from these injections. Now, how do you shape someone's face with a drug that relaxes muscles? Our faces are comprised of competing muscle groups, some of which will work to elevate a portion of the face, while another group of muscles will work against them. For example, one group of muscles elevates the eyebrows, while another group of muscles pulls the eyebrows down. Botox and Dysport both last about 3 to 4 months. It's a little shorter than a lot of people would like, but if for whatever reason you got something that you didn't like, you'd be awful happy that product wasn't lasting a year. Is there a lifetime maximum dose of Botox that I can get? No. Botox does not build up in your system, and when used in the very small doses that we administer Botox to treat wrinkles and lines in the face, there have been no problems associated with any type of buildup of Botox or effect of Botox at a distant site. If you were to stop using Botox or Dysport, would you be different in some way? Would you look older? No, you're no worse off. Can I use Botox in a preventative manner if I'm young to keep from looking older as soon as I otherwise might? Well, it's hard to know the exact answer for that question, but it does seem to be the case. We have a lot of young patients in their early 20s and even younger occasionally who use Botox as a preventative way to prevent wrinkles from occurring. I do believe that Botox and Dysport are very safe products. There's a reason that this is the most popular aesthetic treatment in the United States. It's an effective treatment, it works quickly, and the results really are excellent. If you've been thinking about trying Botox or Dysport, I encourage you to do so. The satisfaction rate after treatment with these drugs is higher than any other treatment that we do. I think you'll like it.